Hello and good afternoon. My name is Lucy Aquino and I'm the Chief Executive Officer of Hispanocare, Inc., a program of Advocate Illinois Masonic Medical Center. You're watching a television show program brought to you by Can Cable 21 here in Chicago. During the next 25 minutes, we're going to be discussing when you should go to the emergency room. Joining me today is Dr. Pilar Ortega, Emergency Room Physician of Advocate Illinois Masonic Medical Center. Thank you, Dr. Ortega, for being on the show with us today.
Thank you for inviting me. It's a pleasure.
Thank you. Dr. Ortega, in U.S. Today, it was reported that 3/4 of emergency room physicians are seeing a huge increase in ER visits. I know that sometimes people are not sure whether or not they should go to the emergency room or what should they do in case of an illness or accidents, but still sometimes you're questioning that. So what are some of the options that people do have? Can we talk about that?
Absolutely. I think one of the first things to acknowledge, Lucy, is that people do have options. When there is a sudden illness or injury or accident that takes place at home, people do have questions. What should I do? Well, one option sometimes is just to stay at home and try some home treatments or therapies that, maybe you've tried in the past that have been successful, and that can be one option. Another option for people is always to call their doctor or to call a nursing hotline or something to ask for advice as to what they should do. Other possibilities would be to go ahead and go to an urgent care center, also known as immediate care clinics, urgent care clinics, express care clinics. And finally, to go to the emergency department. So it is confusing for people sometimes to know, is it the right time to do one or the other of these alternatives?
So if people, with some of these possibilities, sometimes you're still thinking about what is the correct situation, because even though they might have, they might feel it's an emergency, but then you may not feel, it's not that bad, but when it really is.
Exactly.
How do you determine that? Again, calling, but then you might have those situations where maybe telephones are not available in the household, or depending. But if you were to see something, what would that be? I mean, something to actually say, okay, this is not something I can take care of at home.
Right. Yeah. Well, every situation is different. And in general, what we say is for serious and acute medical issues, we definitely want people to go to the emergency department. We don't want people to waste time at home or going to a place where they're not going to have their issue resolved, and it might be a life or death situation. So if it is a very serious or acute problem, and we'll go over some examples now, we definitely would like to see you in the emergency department as soon as possible. And this could entail you calling an ambulance, or it could entail you having a family member, if they are immediately available, to take you into your nearest emergency department. So that's what my general guideline would be. But we can talk about some.
Absolutely. Well, actually, I would like to talk a little bit about examples, especially when it comes to heart attacks and strokes and so on. So can we talk a little bit about some of the signs of heart attacks and so on? We'll talk some about some of those signs. And I know we have some samples here as well. So doctor, let's bring this up.
Absolutely. So first I would tell people, there are certain situations in which you most definitely this is considered to be an emergency, and you should be finding your way to the emergency department. Number one, as you said, Lucy, would be signs of a heart attack. And we'll talk a little bit more in detail of what those are. The second would be signs of a stroke, as you also mentioned. And if people are having trouble breathing, if they've lost consciousness, if they've injured themselves so seriously where they may have a broken bone, where they may have bleeding that they're not able to control at home. Those are things that we can definitely deal with in the emergency department, and that they would not be able to deal with in other situations. So, to start out with your question on what are the signs that, people should be looking out for as far as heart attack symptoms. Well, the most common symptom that we see would be chest pain. Sometimes people also have pain in one or both arms, or sometimes they have pain in one or both arms or the jaw or a few other parts of the body that instead of primarily the chest pain. So it can vary from person to person. Sometimes it's more of an indigestion or upper abdominal discomfort that people report that may be extending somewhat into the chest. They tend to have some shortness of breath, so some difficulty breathing plays into heart attack symptoms as well. Sometimes they have cold sweats, they feel very dizzy or faint. And especially if these things are occurring when you are active or doing some kind of exercise, these would be very concerning signs for a possible heart attack, and we would want to see you in the emergency department as soon as possible.
Now, Dr. Ortega, it's my understanding that some of the signs or symptoms for heart attacks, both in men and women, may differ. Is that correct?
They may differ, yes. They may differ. Also, women, older adults as well, people with diabetes. These people don't tend to have some of the very classic symptoms such as chest pain that we, talk about with concerns for heart attacks. So definitely it is worthwhile to be aware of your own body. And if you notice that there is something that is significantly out of the norm for you and you don't know what it is and don't know how to take care of it at home, or are concerned that it is involving some of these other side symptoms such as sweats and dizziness and indigestion and maybe pain in an arm or discomfort, that you should go ahead and seek emergency assistance.
Absolutely. Now, Dr. Ortega, can we also talk a little bit about stroke, the signs of stroke, which obviously are different from heart attack?
Absolutely. So the signs of the stroke would be, some of the more common ones would be weakness in part of your body. So that would be, for example, one arm, one leg, or one side in general, the arm and the leg on that side. You may notice some drooping on the side of the face on the affected side. You might notice that the speech, maybe because of the drooping of the facial muscles, is weak and the speech is slurred or does not sound normal. Or maybe the person is not understanding everything that other people are telling them. So they may just not be able to respond in a normal fashion. They may not be able to even say what they're thinking, perhaps, when they're relating to their family members. And sometimes just numbness in part of the body, or loss of coordination. So they might, a family member might notice, oh, dad is sort of falling to the side when he's walking. And this is another situation in which timely arrival at the emergency department is very critical in order to be able to give you the care that you need.
Now, you also mentioned trouble breathing. Is fast breathing, slow breathing, does it matter?
Yeah. Well,
or noise during breathing?
All of those things could potentially be serious. In general, when people are having trouble breathing, they tend to begin by breathing more quickly. So rapid breathing is sometimes one of the first signs that we would notice. And then as people, if you let it go long enough that people get exhausted from breathing, then they may slow down, and that's actually a bad sign as well. But yes, depending on what your medical condition may be, whether you're an asthmatic or have COPD or have other lung problems, or perhaps you don't, you should learn through your doctor to recognize what are the signs that you are having a breathing emergency. But in general, with any person who's having abnormally rapid breathing or making noises during breathing, where that may be wheezing or other sounds that are unusual. Also in children, this can be a very significant emergency. For example, if they're choking on an object and they may be making unusual noises during breathing. Or if you observe either a child or perhaps an older adult having a choking episode while they're eating, or maybe they vomited and then they were choking in the process as well. Or if you notice that there are signs that that person is not getting enough oxygen when they're breathing, which would be changes in the color of that person's skin tone or lips. So you might notice some bluish discoloration, purple, or the person might look very pale and may not be able to talk to you in a normal fashion.
Now, I know that summer is upon us, and it is one of those times where kids are running around and anything can break, jumping off the monkey bars or something. So can we talk a little bit about possible broken bones and maybe how to identify that it's not just a simple sprain or a boo-boo, as the kids would call it. Can we talk a little bit about that?
Right, and sometimes it's hard to determine. You know, we don't have x-ray vision. We don't as physicians, and we don't as parents either. However, there are some things to look out for that would indicate that it might possibly be broken and might be worth going to see a doctor to see if you need an x-ray. And some of those things are if you see a deformity. What that means is you see that extremity, let's say the arm or the leg, and it just doesn't look straight the way that it normally does. So there is a large amount of swelling, or it looks like there might be even some bone that is in an abnormal position. Well, certainly if it's protruding out,
you want to run to the emergency room.
I think people would probably recognize that as an emergency, but sometimes it's hard to tell the swelling from a sprain as opposed to the swelling from a broken bone. And the truth is, if you're not sure, it probably is worth having a doctor having a look at that. Also, if the pain is very severe and the patient can't walk, for example, or can't use that arm, then those would be signs that there is a serious injury, maybe a fracture, and you should probably go to the emergency department to get that looked at.
So, you know, we alluded to emergency rooms and urgent care centers earlier. In some cases, even some of these, I mean, sometimes folks will run to the nearest Walgreens or urgent care center.
Right.
But that's really something that needs to make a decision, especially if it's a real emergency, is go to the emergency room when you're not sure. I mean, why run to an urgent care center if all they're going to do is turn around and tell you to go to the emergency room? So times can be of an essence.
Right. So I think some of the issues that we're talking about in more detail are ones in which I think it is worthwhile to go straight to the emergency department because, like you said, time can be of the essence in the appropriate treatment of some of these conditions. But there is, I think, a time and a place for an urgent care center to manage your conditions as well. Some of the main differences between going to the emergency department and the urgent care center is that at the urgent care center, they really specialize in rapid care for more simple conditions. So if you have a situation in which, for example, you would need some special kind of pictures taken or imaging, let's say a CAT scan or a CT scan, that is not usually an option that is available at an urgent care center.
Right.
In addition, if you might need a specialist consultant, such as a bone specialist, a heart specialist, depending on what you're coming in for, again, these are things that would not be immediately available in the urgent care center. And like you said, if they recognize that that is what's going on, they will refer you to go directly to the emergency department. However, the care is usually faster at an urgent care center because they are, dealing with, quicker problems that can be resolved a little bit more quickly for patients. So, in some cases where it might be a fairly minor situation that you might need to get resolved quicker than you can get to your own doctor, let's say, then it can be a good option.
Absolutely. And they're everywhere now. You can basically find them just about in every other corner, it seems like. So they're popping up and obviously making access to care that much quicker and with more options as well, instead of running to the ER all the time for something that doesn't really need that type of care. Before, you also mentioned that we talked about some of the chronic problems, but I do know that a lot of times if we don't have a primary care physician, it seems that we use the emergency room often. And sometimes by doing that and we overload the emergency room, it really ties up the time for those real emergencies. Can we talk a little bit about that?
Absolutely. I think that the best situation is for people to find a medical home or primary care medical home where they can really get to know a doctor and a doctor can get to know them. And the clinic can really be familiar with what chronic medical problems, take care of medication refill issues, take care of their chronic medical conditions. And that way, when something comes up in your medical condition that changes to some degree and you're concerned about it and it happens, let's say in the evening time, maybe the clinic is closed, you can still call the clinic, talk to somebody. There's usually an on-call person, a doctor or a nurse or an answering service that you can talk to and tell them what you're concerned about. They can pull your records and have more information about you and give you more advice that is more specific towards what you should do in that situation. You're going to have less of a waiting time. You're going to have somebody who knows something about you talking to you and giving you advice and maybe getting you an appointment quickly, let's say the next day, to be seen. So yes, I do think that that is the ideal situation, not to wait till you're in an emergency and you're, all out of your medications and you're not sure then what to do or how to get those medications, but rather, pre-plan for these things, take care of your health, try to prevent problems that can result from not having a regular doctor and getting established at a clinic.
So I know there are also times that some problems may occur, but sometimes these are some of the things that you might want to just stay home and wait. What are some of those things?
Yeah, there are some things that, for example, if you know your own medical conditions, let's say you have asthma or you have diabetes, and you know how to manage those things on a daily basis, but one day you notice your sugar is a little bit high, and you have instructions for what to do from your doctor, you know how much insulin you need to take, etc. That would be one example where it would be fine to take care of that. Or let's say if you have asthma or some chronic lung problem and you have an inhaler and you're feeling just mild shortness of breath because of something that triggered it, it's okay to try an inhaler treatment at home and try and see how you feel before proceeding to elevate that to another, to going to a facility such as an emergency department. Other things that people might want to stay home for would be just maybe a mild fever, maybe cold symptoms. And we can talk maybe a little bit more about fever because there are some things that would be danger signs for which we would definitely want people to come into the emergency department. But for mild aches and pains, mild fevers, mild colds, there are definitely some medications that maybe you have over the counter available at home that would be safe to try first to see if that resolves your symptoms prior to escalating that.
Well, especially during flu season. It's just, flu is the horrible thing to actually get. And trying to get through that, and you actually feel like you're dying because it's that bad. But sometimes it's not needed for an emergency room visit, and an urgent care center can actually take care of that potentially.
It's true, yes, and people can feel miserable. I definitely can commiserate with them when they do come in feeling so miserable with any of these symptoms. But it might be even in their own best interest, to rest and recover at home. But if unsure, you can always call your doctor ideally and find out, these are the symptoms I'm having. What do you think? Should I go into the emergency department? Can I come see you tomorrow? What would be the best approach to that?
Again, I want to remind our viewers that with me today we have Dr. Pilar Ortega, emergency room physician at Advocate Illinois Masonic Medical Center. Dr. Ortega, on the list that we showed earlier, let me bring it back up. One of the things that most folks don't talk about is really the suicidal thoughts. It's not something that a lot of people give thought to, or taking someone to the emergency room. Doctor, can you talk a little bit about that?
Yes, and thank you for bringing that up. And putting up the suicidal thoughts as the main mental health emergency is really just representative of what a series of mental health emergencies can be to actually warrant people going into the emergency department. So one thing certainly would be having a person tell you that they are thinking about killing themselves, or if you yourself are having serious thoughts, perhaps with a plan of what you would do to take your own life. But there are other things. For example, perhaps there is somebody at home who has a substance abuse problem, and they're found in such an intoxicated state where they're not appropriately responsive to their family, and somebody is concerned about how they're breathing or able to respond to them. That would certainly be a medical emergency we would want to see them for. If somebody has chronic mental illness, or perhaps an undiagnosed mental illness, so they may not have a diagnosis already, but they're showing signs that they just cannot function in their daily life. They're not going to work, or they're not able to do their daily activities. They're not eating or feeding themselves. They're not able to take care of whatever the normal activities of their life are. Then that would warrant also having somebody, at least somebody's advice on what to do for this person. If they are not known to a doctor or a clinic, then going to the emergency department for an evaluation would be appropriate as well.
And there they can also obtain a referral and the right connections, at least provide some sort of support and resources in which these individuals can obtain.
Absolutely.
So, doctor, I know that when we run to the emergency room or try to handle any emergencies, we're not always thinking about things that we should take with us to the emergency room for that visit. So there are things that you should take with you. And what are some of those things, doctor?
Yes. The most helpful thing from the patient and the doctor's standpoint for patients to take in with them would be, if they do have a primary care medical home, a primary care doctor, that they take the information with them of who that doctor is, phone number ideally. In addition, if they have a list of medications that they take, it would be very, very helpful to bring that in, either written down, or if you have a little bag where you keep all your medications, just go ahead and bring that in, and we can always sort through that in the emergency department. But those things are pretty critical so that we can know what treatment you're already on at home and how we can best treat you in the emergency department under the condition that you're coming in for. If you're taking care of somebody else and bringing them to the emergency department, then I do recommend that people keep with them at home, for anybody that they take care of, a list of the medications, allergies, and medical problems that person has, because it's very hard sometimes to just get all that information together at the last minute when you're already in a stressful situation and trying to get this person to the emergency department.
And for those caretakers, as you're mentioning, providing that information and having those meds. Now, if that's not possible, it's always wonderful to prepare before an emergency. So, taking our iPhones all have cameras on them these days, so you can easily lay out the medications, take a picture of it, has all the names of the meds on it. You don't even have to write it down. You can, take pictures of it if need be, if that's what it comes down to. Your insurance cards if need be, your physician provider, telephone numbers, all of those things are important. Sometimes in emergencies we don't think about those things, but it's always better to be prepared than not.
Absolutely.
Absolutely, setting up that sooner rather than later. Dr. Ortega, any other advice that, as an emergency room physician, you see things day in and day out. What other advice can you give our viewers about our emergency rooms and the do's, the don'ts? Give us your wisdom.
Sure. Well, in the emergency department, we are a resource for all patients whenever you might need something and can't get help anywhere else. So that is absolutely the bottom line. But it is wise for all of us to use this resource of the emergency department wisely so that we can be available to you when you really, truly need it the most. We are always a phone call away. If you call the emergency department, if you can't get a hold of your own doctor and want to know, look, is this rash something that I need to get looked at tonight? Or do you think I can wait to be seen at a clinic tomorrow? You can always give us a call and we can give you, guide you to some degree over the phone. But of course, if you can't get a hold of us, can't get a hold of your doctor by phone or anything else, of course we want to see you and we want to be able to take care of you and offer the best support and advice that we can.
I know that our time here goes by really fast, but I want to make one last take on the emergency room, especially for children. A lot of times babies and newborns are taken to the ER for whatever reason. There are things that mothers should also take with them when they go to the ER, because the ER does not have those baby bottles and formulas, and at least not, and then they may, I don't know. But is there something you can recommend in that? I hear that a lot too from new moms.
Sure. I mean, resources are variable at different emergency departments, especially whether or not they're accustomed to seeing a lot of pediatric patients. But having something to entertain your child and possibly some extra formula and things like that to feed them is probably a good idea. In some cases, if the child is having abdominal pain or something like that, you may actually, it may be better not to feed them for some time until they're seen by a doctor. But so you can always ask at the triage desk and see what they recommend before actually feeding your child if you're coming in for some emergency.
Absolutely. Dr. Ortega, thank you as always. I mean, it's such a pleasure always to have you on the show. So much great information, but our time goes by so quickly. So on behalf of my colleagues at Hispanocare, at Advocate Illinois Masonic Medical Center, and Dr. Pilar Ortega, thank you so much. I want to thank you for allowing us to talk to you today and to share this very important information with you. I'd also like to thank Can Cable 21, bringing this information to community and to our viewers. So until next time, my name is Lucy Aquino with Hispanocare of Advocate Illinois Masonic Medical Center. Till next time, stay tuned for more information coming your way.